Hello again. Welcome to Jorie AI's podcast here in Las Vegas.
All right.
Hey, Jorie, coming to the show once again, transforming the way we bill and collect, moving mountains with AI in the healthcare space. All right, so today I'm joined by the other Lows, Dr. Erwin Lo, my brother over here, neurosurgeon, Conrad Lo, neurosurgical PA.
Hello.
We are the lowest of the lows right now. Okay.
All right.
No more jokes like that. I'll try to.
Crazy.
All right. So real quick, we want to run on a few topics here. Obviously, this is exciting. We are touching on a lot of AI, and we see it happening in all different kinds of fields. But since I got my brother here and my cousin, they're in the neurosurgical spine field, and they're seeing AI penetrate that field as well. And I think the biggest one that they've seen just start attacking the ambient listening space, which is basically the conversations that are happening between the patient and the doctor. So these guys are used to having conversations with patients. I'm not. I never talk to them.
Yeah. And
so, Conrad, why don't you talk a little bit about your experience?
I'll talk
there.
about what's actually currently
First,
going on.
Let everyone know what you do in that.
Sorry, Conrad Lo. I'm a neurosurgical PA. I'm a traveler. I've been across the country, in different level 1 trauma centers, where volume is kind of the problem with, retention and that's why I'm there. So to handle those high volume places, it's acute brain and spine injuries. But in regards to what Sal, mentioned earlier is that, with the implementation of AI, we're currently using Epic's DAX Copilot, which is what the ambient listening is about. And it's very interesting where you don't have to sit by a computer and interview a patient. You just freely talk and it records you. And that kind of frees you up to focus straight on the patient, right? And you're not burdened by inputting data or transcribing, and wasting time, right?
That's right. That's the key, because there's such a shortage now for medical providers, not just physicians, but nurses, physician assistants, nurse practitioners, to be able to deliver that healthcare to the population. So the more efficient we can get in terms of doing the initial evaluation, coming up with the appropriate diagnoses and a treatment plan, technically, we have the potential of seeing more patients on a given day than we have before. So if you can shorten, if you can see, because with the help of automation and ambient listening, instead of seeing 10 to 15 patients a day for a specialist, you can see 30 to 40 and have enough time to be able to get all the data in, order the appropriate studies, and move that patient along to the next step. You can get them through their healthcare journey that much more efficiently. And that's going to be huge, especially when you're predicting by the next 3 years, almost a 50,000 physician shortage just on the physician side. So that can be a key game changer there to help deliver that healthcare to the population.
So imagine that you have a virtual assistant. You talk about ambient listening. So maybe some folks don't know what that is. So basically, this AI is listening to your conversation, and it's figuring out all the notes, diagnosis codes, etc. Not just dictating it, but organizing it in a way where here is the patient's demographics, everything, and then care plan and diagnosis, next step, maybe an MRI. You mentioned you need an MRI for that spinal cord injury. And then AI could schedule the spinal cord injury MRI to the nearest MRI for that patient.
Right.
And so even taking it onto that next level, obviously, this is alleviate things that shortage in doctors. You hear a lot about physician burnout, because what are you doing right now? You're on your computer, entering the notes as you talk to the patient, enter the notes, And hopefully your notes are as good as the other person's notes so that I could take that AI and move it along. But now you have AI listening who's following the rules of the similar rules that you do in order to get a clinical diagnosis. But it's
Right.
not making a diagnosis. You're reviewing it.
Correct.
You say, this is what I said, and then you move it along, right? All right, so let's talk about, well, now that that's doing that, what else are you going to do? All right. So obviously it frees up your time. Let's talk about some crazy stuff that happens, right? You talk about a physician shortage. You need AI to help triage, do all that stuff. What are some of the crazy stuff that happen with Conrad, you could talk to us because you're in the level 1 trauma centers, right?
Right. Right.
Heaven forbid there's a car accident in your rural area and you have a brain hemorrhage
Right.
and there's no doctors to treat you. All right. So tell me what you see.
So, again, volume's kind of the key factor with all level 1 trauma centers. And that's one of the reasons for burnout is that you're just overwhelmed with the volume of consults, the volume of work. So my experience, in some of the systems is that, AI is saving us time and, stress by being more efficient, right? It's saving time where we could get the notes. I'm working 12, 13-hour days, and it's kind of frustrating when you have to sit there and work for another hour or 2 hours just to chart, right? So if ambient listening can take care of a lot of that documentation, I get to go home. And in the end, that's what we all want to do is just go home.
But thinking about real situation in these trauma centers, how many times you see a gunshot wound to the head?
Oh, yeah, almost every
week?
Yeah, level 1 trauma centers are kind of the highest level. So you're going to see the most severe trauma cases, brain and spine injuries.
On top of that, you got to meet with the patient's families. You got to enter in all the notes. You got to do all your homework. You got 5 or 10 patients coming in that you're kind of monitoring their care plan, making sure they don't crash, right?
Yeah, and that's all relating back to being efficient, right? Again, trying to tackle volume and urgent cases such as multiple brain injuries. Like there was one case where there was 2, severe brain injuries, and the trauma team called me into the CAT scanner and said, listen, we got 2 major brain injuries. One's a gunshot to the head. One's a severe TBI from the car crash.
Traumatic brain injury.
Yeah, traumatic brain injuries. And you really do have to critically think and triage and be efficient. So hopefully, with AI and all aspects of it, we could try to cut down on,
Erwin,
delays.
what's some pros and cons in regards to like the AI and robotic surgical interventions, especially? Have you seen that in the brain or in the spine?
Well, there's certainly advantages in terms of planning surgical approaches using AI through robotics in combination to be able to safely navigate through anatomical corridors to be able to stabilize the spine, accurately place things like pedicle screws when you're doing reconstructive procedures. You have to be careful though, because there still has to be the human or the physician surgeon element of planning out the appropriate plan of care, especially if you're doing surgical planning. So that has to be done. You can give parameters so that the automation can help get you to your final end product. Right. At the end of the day, if you're reconstructing somebody's spine, you're having to plan out the approach, figuring out what you're going to decompress, which levels of the nerves and the spinal cord you're going to decompress. All that is the human element of it, and then the AI can help guide and safely navigate to the appropriate approach and to save time. to be able to minimize blood loss and get that patient past their surgery through the anesthesia portion of it so that they can get to the recovery room or in a much shorter period of time otherwise.
All right, you heard it from the neurosurgeon, folks. So obviously, AI, robotics does play a role in the surgical intervention, but the surgeon is always in control, managing that service line. Now you can extend your services across rural health systems across the board. Obviously, this is constantly changing. Let's talk about proactive, right? You talk about a lot of the things that you have to work on should have some diagnostic imaging or you're seeing
That's
now more
correct.
AI penetrate things like MRI,
Yeah.
understanding and reading. Like you see the radiologists
So,
now
yeah.
utilizing the automation to find things that you would never find before. You could predict breast cancer 5 years in front. You can look at, let's say, a tumor in the brain that might be picked up by not only MRI assisted by AI to be able to find that. Are you starting to see that it's becoming more and more important to have those diagnostic imaging and exams utilizing artificial intelligence?
That's correct. And actually, it is currently a reality right now because, when I'm working at nighttime, and 2 a.m., the traditional way
that's technically the morning, Conrad.
right, right. But, again, to my Erwin's point, it's staffing, resources, etc. With the lack of staffing or resources of radiologists, a lot of times these were farmed out to maybe some unknown radiologists across the planet, right? And there'd be mistakes, there'd be differences in, accuracy. I'm actually seeing right now that some of the preliminary reads are being read by AI. So that's a reality that's happening right now.
So I was sitting on a panel where people were like, wait, hold the guardrails on AI. It's going to kill people, right? And then on the flip side of it, there was 600,000 deaths last year alone on misdiagnosis, right? That AI could have prevented. So we're in a crisis already.
Right.
Obviously AI could be the gatekeeper. Obviously there should be guardrails, but at the end, this combination of not cut over, doctor, physician assisted AI, it should be the transformation of AI, not automatically just let AI loose.
There's
And there-
definitely a huge advantage in the diagnostic imaging because you can develop programs and protocols where the human eye, only has a certain limit of perception to be able to interpret an MRI or the Hounsfield units on a CT scan. And you can get that so precise with the algorithms on AI that you can technically pick up minor abnormalities that the human eye and interpretation would miss.
Like one of the things that I really lean on with the AI reads is at nighttime when you have a non-traumatic bleed, like a subarachnoid, and you're concerned about an aneurysm versus something else, that has two different management approaches. So getting a read that's accurate right away is essential to managing that case, right?
Would you see in the future, not to switch topics, would you see in the future an AI medical assistant robot?
Again, there's certain aspects that AI and robotics or computer can do to make things more efficient. But to be honest, any computer or AI can't show empathy, right? And computer really can't, gauge someone's trust in what you're telling them.
You're saying it can't create feelings. Like what was that from Star Trek?
Well,
Data,
well, no,
right?
right,
He
right.
couldn't figure out the feelings, right?
Well, let me give you an example. So that gunshot to the head, I had to talk to the family right after that. And I had to say, listen, there's really nothing that we could do from a surgical standpoint to save your loved one. That conversation can't come from a computer. I mean, think about, you going to the hospital and having some kind of emotionless data person just say, sorry, there's nothing to do.
That's
right?
pretty deep, Conrad. How many times do you do that?
Well, for me, working in
All
level
the time.
ones, that's part of the job, right? That's why I'm there.
All right, let's talk about the feelings of AI and everything. Do you think Elon Musk could really build his own girlfriend? I'm
If
hearing
you
it
put
all.
a wig
Yeah.
on it, yeah.
No, all right, everyone. Thanks everyone for your time. Obviously, this is something unique where I got the Lows here talking about
Yeah.
AI at the Las Vegas conference at Health. This is amazing. We're going to continue to push artificial intelligence. We have that healthcare background. We're leveraging not only what we learned from what you're doing in the field, but we're taking that and we're putting real technology behind it, so it knows and understands the things that you're going through. How many you're seeing gunshot wounds? You're working in the brain all the time, the
Yeah.
spine. You're meeting with the patients. You're talking about empathy with the patients. We're training our AI to be able to model that across the care continuum and multiply your throughput. Thanks, everyone. Thanks for joining us at this cool conference. We'll hang out here at Jorie AI. We'll see you next time.